Morning, everyone. I'm Rebecca Vickers with the Florida Alcohol and Drug Abuse Association, and we will be getting started in 5 minutes. Good morning, everyone. I am Rebecca Vickers, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar entitled Patterns of and Trends in Substance Use in Florida Annual Update with Ben Hackworth. This webinar is being made available through collaboration of the Florida Department of Children and Families, Office of Substance Abuse and Mental Health, and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and will only be able to view your name. If you have questions, please send them to the presenter and me, the host, by the chat panel. The button to open the panel is usually located in the upper right side of your monitor. Please use the chat panel to send any questions you may have as you think of them. The presenter will address the questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and these options are posted in the chat panel too. If you continue to experience poor audio through your computer, try rejoining the webinar and call in using the telephone I will call in option. You must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. The recording and materials used in today's presentation will be available on the FADA website within 30 business days. To access the recording and PowerPoint, go to www.fada.org/resource center and then to our training library. FADA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credits for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on FADA's website. You will first need to register or sign in to your account to complete the evaluation. Information you provide FADA as a part of registering remains confidential. Statements of credit will be posted within 30 business days after the evaluation closes in Individual Professional Development Journal for persons completing the evaluation and attending the full webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Do note that the evaluation will close at midnight on Tuesday, July 5th, 2021. Up to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license numbers for reporting to CE Broker when you register with our site. If you are certified with the Florida Certification Board or licensed outside of the state of Florida, you do not need to provide your certification number when you register with our site. Note, please, that WebEx monitors arrivals and departures of attendees and provides a report upon completion of the event. We are not permitted to provide a certificate of attendance if you do not attend the entire webinar, and we are not permitted to provide partial CE credit. Benjamin Hackworth has over 4 years of experience providing community presentations, technical assistance, and training on substance use and mental health prevention services. As an independent contractor, he collects, analyzes, and evaluates data for local, state, and national dissemination through written reports and oral presentations. Ben previously contracted with the Center for Substance Abuse Research as a Centennial Site epidemiologist for the National Drug Early Warning System funded by the National Institute on Drug Abuse. Ben graduated with his Master's of Public Health from Northwestern Ohio Consortium for Public Health, a joint collaboration between the University of Toledo and Bowling Green State University. He specializes in health promotion and education. And now I'd like to welcome our presenter, and Ben, I will turn the presentation over to you.
Great. Thank you so much, Rebecca. Can you hear me?
Yes, we can.
Okay, great. Good morning, everyone. I hope everyone is having a great morning. Thank you again, Rebecca, for that great introduction. And thank you all for taking time out of your busy schedules to join us today to learn more about substance use and trends. Again, my name is Ben Hackworth, and I'll be presenting the most current patterns and trends in substance use in Florida. Before we begin, I just want to apologize for my voice, and I might have to mute myself because I have a bit of a cold, and so I might be coughing. Hopefully, you won't have to hear all that. So anyways, before we begin, I need to go over a little bit of a background for substance use trends in Florida. To begin, the behavioral health workforce in Florida is comprised of professionals tasked with promoting the health and well-being of Floridians through not only prevention and early intervention strategies that reduce the impact of substance use and mental health disorders, but also person-centered treatment to those Floridians managing mental health disorders, including substance use disorder. In order to effectively target limited resources to prevent, delay initiation of, and treat existing substance use disorders, the state, regional, and local behavioral health workforce must be aware of current patterns and trends in substance use and abuse across the state. Thus, this report provides an overview of current patterns and trends over time of substance use and select consequences among Floridians. For context, statewide data are presented alongside comparable national data. Substance use is common, though it can lead to negative health consequences. In this presentation, the patterns and trends in use for various substances are shown in Florida, alongside the prevalence in the United States as a whole for comparison. The objectives for today are as follows. We hope that by the end of the presentation, you will be able to identify updates in substance use trends for Florida youth. We also hope that you will be able to understand patterns of substance use regionally and statewide. And lastly, we hope that you understand morbidity and mortality trends in Florida as well. And just a brief introduction, this is the update version of the 2021 update report titled Patterns and Trends of Substance Use Within and Across the Regions of Florida. This can also be found, the written report can be found on FADA's website. And in addition to the updated data, we have new state-specific data from national surveillance efforts that are included within the report. Some of the data sources that we use and will be presented on today are based on the following. The National Survey on Drug Use and Health, sponsored by SAMHSA, the Youth Risk Behavior Surveillance Survey, or YRBSS, sponsored by the Center for Disease Control and Prevention, Florida Health Charts, sponsored by Florida Department of Health, and lastly, the 2020 interim report prepared by the Florida Medical Examiners Commission, which identifies drugs in deceased persons. So here we have a breakdown of Florida by geographic region or managing entity. The Florida Department of Children and Families contracts with 7 regional systems of care known as managing entities to provide behavioral health services to citizens throughout the state. Because Florida is such a large state with a diverse geographic population, this model allows each managing entity to respond to specific behavioral health needs in its region within Florida. With the exception of one, each region is comprised of a group of geographically contiguous counties. And just to quickly go over the managing entities, because I'll be going over these regions for comparison throughout the presentation. We'll first start out with Big Bend Community-Based Care in blue. And this region is the smallest population with 1.5 million people, or 7% of the state's population, dispersed throughout a larger geographic area. Lutheran Services Florida makes up the northeast and part of Central Florida in yellow. Central Florida Cares is in orange, serving 13% of the population. Southeast Florida, serving 10% of the population. We have Broward Behavioral Health Coalition serving only Broward County. And then we have the South Florida Behavioral Health Network, only serving 2 counties, but making up 13% of the state's population at the very tip of the state. So to get into our first data that we're going to be talking about, we will look at the Youth Risk Behavior Survey among US and Florida high school youth from 2019. Most YRBS data is conducted during the spring of odd number years, and results are released in the summer of the following year. Therefore, results from the 2019 national, state, and local YRBSS were released during the summer of 2020. CDC and other federal agencies routinely use YRBSS data to assess trends in priority health behaviors among high school students, monitor progress toward achieving national health objectives, and evaluate the contribution of broad prevention efforts in schools and other settings toward helping the nation reduce health risk behaviors among youth. I'll go over results by male versus female, results by race, and results by sexual orientation for both the US and in Florida. So to begin, US females have higher rates in 2019 for the following. They have higher prevalence for binge drinking, past 30-day alcohol use, and ever taking a prescription drug without being prescribed by a doctor. US males have higher prevalence rates in 2019 for having their first drink of alcohol before age 13, ever using marijuana, trying marijuana before the age of 13, and past 30-day or current use of marijuana use as well. Florida females have higher rates of the following for 2019. Florida females have a higher prevalence for binge drinking, past 30-day alcohol use, ever using marijuana, currently using marijuana, and ever taking a prescription without being prescribed by a doctor. Florida males have higher rates in 2019 for ever using cocaine and trying alcohol and marijuana before the age of 13. This is important to look at between male and female, just to see what the patterns and trends are among each. We're seeing a higher increase and prevalence in Florida females with alcohol use, specifically in more recent times, according to these data results. And to move on to race, United States high school youth by race who have the highest prevalence of past 30-day alcohol use and binge drinking were that from white youth. American Indian and Alaskan Native youth unfortunately had the rest of the high prevalence in the rest of the categories. So they had higher rates for um, having their first drink before the age of 13, trying marijuana before the age of 13, currently and ever using marijuana and ever using cocaine, as well as ever taking a prescription drug without a doctor's permission. For Florida, by race, Asian youth had the highest prevalence for ever using cocaine, trying marijuana before the age of 13, and ever taking prescription drugs without a doctor's prescription. For white youth in Florida, past 30-day alcohol use, binge drinking, and past 30-day marijuana use had the highest prevalence for Florida youth in 2019. For Black youth in Florida, they had higher prevalence for having their first drink before the age of 13. And for those individuals who identify as multiple races, they had higher prevalence for ever using marijuana. And lastly, we'll go over sexual orientation by substance use in the US and in Florida. They actually both US, Florida, and both US and Florida uh, lesbian, gay, and bi individuals all had higher significance in the following substance use categories: having their first drink before the age of 13, currently using alcohol, currently binge drinking, trying marijuana before the age of 13, currently using marijuana, ever using marijuana, and ever taking a prescription drug without a doctor's permission. So all these categories have high significance among US and Florida lesbian, gay, and bi individuals, which screams out a prevention tactic for this group that Florida workforce should be trying to help with this group. For this slide, we'll also go over the YRBSS for ever taking a prescription drug without a doctor's permission in the US and Florida. And we'll be comparing 2017 to 2019 data. So in 2017, the Youth Risk Behavior Surveillance Survey added this survey question on prescription pain medicine misuse. Due to this, we'll only have limited trend data, but we'll be able to compare 2017 and 2018 national and statewide results. So on the left, you'll see the United States in 2017 and 2019. There was a 0.3% increase that occurred in 2019 for high school students in the United States who have ever taken a prescription pain medicine without a doctor's prescription. On the right side, we'll see Florida youth from 2017 to 2019, and we'll see a 2.7% increase from these 2 years. Although Florida high school students had a higher percent increase from the previous survey year, the percent of high school students who have taken a prescription pain medicine without a doctor's prescription or differently than how a doctor told them to use it was lower than the high school students by 0.4%. Other surveys may differ than what the YRBSS has results for as well. So for the National Survey on Drug Use and Health, past year misuse of pain relievers have been steadily declining among Florida youth, though the prevalence in Florida exceeds that of the United States. So we see two different survey results with two different outcomes, so we have to take those into consideration as well. Next, we'll see lifetime cocaine use among US and Florida youth from 2009 to 2019. Lifetime cocaine use in the US saw a slight increase in 2011, but has continued to decline. As you can see, the US line is in orange, and the highest rates that we saw in 2011 was 6.8% of students saying that they had ever used cocaine. In the blue line, we'll see Florida youth who had a decreasing trend until it saw an increase in lifetime cocaine use in 2015 with 6.2%, but then it has continued to decrease. According to other surveys like FISIS, the Florida Youth Survey on substance abuse, past 30-day and lifetime use of cocaine among youth in Florida has decreased since 2010. Past year cocaine use among youth in Florida and the US has also decreased since 2006, according to NSD-UH data. We can look at lifetime and past 30-day use marijuana among US and Florida youth from 2009 to 2019. Though a Schedule I drug under federal law, a majority of states have legalized recreational and/or medical use of marijuana. However, use of marijuana is not without consequence. Not only can use of marijuana lead to marijuana use disorder, but there are also short and long-term effects of marijuana use on the developing brain. Going back to the chart, the past 30-day use marijuana use in Florida and the US are on the bottom in blue and orange. Past 30-day marijuana use in the US and Florida show similar trends with higher rates in 2011 and 2013 and a decrease in 2017. However, the most recent data shows a slight increase in 2019. Lifetime marijuana use for Florida and the US are in yellow and gray, and you can see it is slightly higher. And we also see a similar trend with higher rates in 2013 and 2015, with the lowest point in 2017, and a slight increase for US lifetime use. Next, we'll go over past 30-day alcohol use among US and Florida youth from 2009 to 2019. Past 30-day alcohol use among Florida youth in 2009 was just over 40%, while 10 years later, in 2019, past 30-day alcohol use among youth in Florida is just over 25%. Past 30-day use among US youth has continued to be slightly higher than Florida rates from 2009 to 2019, with the exception of 2013 and 2015 results. Among other surveys like NSD-UH, lifetime past year and past month rates of alcohol use in the same period have been declining more quickly among Florida youth than the YRBS survey data. Now we'll go over those who currently binge drink among US and Florida youth from 2017 to 2019. This question was also just recently answered in 2000, or sorry, recently put on the questionnaire in 2017. So that's why we only have two 2 years to compare for our trend line. So in general, alcohol use is most common in the United States, and consuming too much alcohol, as we know, can result in a range of negative health consequences, including alcohol use disorder and death. It can have such impacts that engage in risky or violent behaviors, and binge drinking is also has very high health impacts on individuals, especially for adolescents. So going back to the chart, as we see on the left, we have U.S. youth in 2017 and 2019. We see a 13.5% of youth currently binge drinking in the US, and then a slight increase in 2019 who said they have currently binge drink. In Florida, the opposite happened where we see a decrease from 12.7% to 12.4% of those who say they currently binge drink in Florida. Okay, here we have select substance abuse consequences. So there's a countless number of negative consequences that can result from substance use. Some of those consequences include drug-related arrest and citations, a portion of which co-occur with poor health outcomes. As presented in the injury pyramid for substance use, shown here, only a portion of those who use substances will experience these negative consequences, which can both directly and indirectly contribute to poor health outcomes, potentially resulting in long-term health disparities. So this is a really good graph to use for select substance use consequences. And I kind of want to try something in the chat box and kind of make this more interactive. So if we go through all the levels, if we start with at the bottom, for at-risk behaviors, we see the example is past year drug use. I want you all to, in the chat box, come up with some other at-risk or high-risk behaviors for substance use. So in the chat box, what are some risk factors for youth to have high-risk substance use? Okay, so the first person I see is history of sexual abuse in the family. Yes, that's perfect. ACEs, yes. Past sexual abuse, using substances before school, history of trauma, history of abuse, bullying, mental health issues, parents who use drugs, yes, that's a big risk factor. Childhood trauma, that's going back to the one of the ACEs. Parents who use or misuse at home. Okay, so these are all really good. So some risk factors, I'll just name some other ones. I think you named them all though. So poor parental monitoring, favorable parental attitudes towards the behaviors. So maybe parents are okay with their kids drinking or using other substances. Family rejection of sexual orientation or gender identity. I saw someone put peer pressure, so association with who you hang out with, who your peers are. So some other ones I don't think were mentioned are low academic achievement and lack of school connectedness. So lack of involvement in school can also be a risk factor as well. Good job, guys. Okay, so we talked about risk factor or risk behaviors for substance use. So what are some protective factors? What are some prevention tactics that we can create to help prevent these risk behaviors? So in the chat box, again, I just want to hear from you guys. What are some protective factors for high risk substance use? What do you guys think? Having a mentor, that's really great. Family bonding and school commitment. Family support, that's great. After school activities, yeah. Access to resources, I love that. Having a trusted adult, that's a really good one too. I see spiritual connectedness. I love that one. Good coping skills, yes. And those need to be learned sometimes. Absence of severe childhood trauma, yes. Okay, so those are all really good. I think we mentioned all the examples I have here. I think you all mentioned them, so that's great. Um, I think one that I haven't seen yet is parental disapproval of substance use. That's the only one that I don't think you guys mentioned, but everything else looks really great. Awesome. Okay, so we have the bottom level set. We all understand that. So let's move up one level. So with substance abuse consequences, there might be some other negative consequences. And in the example here on the pyramid, we see arrest, crashes, but what are some other negative consequences of high risk substance use? Can we think of anything else in the chat box? Irrational decisions, loss of trust, inability to attend classes. That's a really good one. Low self-esteem, expelled from school. That's a really good one. Decreasing grades, trouble in school, getting kicked off a team. Really great answers. Poor peer relationships, anger/violence. Yeah, these are all really good. Some other ones would be youth are also at high risk for injection drug use. They're also at risk for overdose, as someone mentioned. They're also more likely to be involved in sexual dating violence or a victim of physical violence. Some other negative consequences is that substance use is also associated with sexual risk behavior and mental health and suicide risk. So yeah, good job, guys. And so we moved up a level. What are some prevention tactics that we can create or think of for this stage? So this one might be a little bit harder, but in the chat box, can you think of any prevention tactics at this stage for people who use substances? Connection with a mentor, that's really good. Treatment, yes. Mental health services, yes, that's a great one. NA, yes. Maybe this one wasn't as hard as I thought. Positive peer supports with individuals who have lived experiences. That's a really great answer, Jill. Yeah, so those are all really great. Some other ones would be screening individuals for risky substance use behaviors so that we can get them into appropriate treatment or receive some type of intervention at this point. Um, I know, for example, there's also classes for kids who might have received a DUI who are underage and they have to take a class. I know that because I had to teach this class. So there's also that. So you're trying to catch these instances where youth might have, you know, already are at a high risk for substance use. So we're trying to prevent from anything escalating anymore, right? Great. And then what are some, oh, okay. So then we have the next level. We have emergency department visits, and then we also have hospitalizations. So, um, just to clarify, so emergency department visits are for this example are due to non-fatal overdose, which are characterized first. Hospitalizations are resulting more from complications with emergency department visits. So, what are some harm reduction tactics we can help create to provide wraparound services for individuals visiting emergency departments or being hospitalized for non-fatal overdoses? So in the chat box, what do you guys think? What's some harm reduction tactics for individuals who are at this point in emergency departments and being hospitalized? Integrative care in physician offices. Narcan. Oh, that's awesome. Yes. Clean needles. So needle exchanges. Funding for medications that reverse overdoses. Yes. Trained professionals in the ER. So yeah, expanding education for those in the emergency room. Great. Starting MAT, medication assisted treatment. Yes. Those look all great. Yeah, so for my examples, I just had naloxone, treatment options. Um, I don't know if some of you have peer specialists in your ER rooms. I know that was a program I used to work with in Florida, and having a supportive individual who has lived experiences that can help this person out. Because sometimes they get discharged and they just go right back into the real world. Sometimes they need a supportive individual right at that point when they get discharged. So yeah, those are all really great answers, guys. And then lastly, we see at the top of the pyramid is death. And death is ultimately what we're trying to avoid with all these prevention, harm reduction, and treatment options from the bottom to the top. So that's why it's important to provide as much resources to individuals who abuse substances as much as possible, because unfortunately, there's no option to help someone who has reached the top of the pyramid because there's no way help them once they are dead. So that's why we're trying to come up with some prevention tactics and try to help people who are already using have some harm reduction tactics and options for them as well. So I really appreciate this little interactive chat box, you guys. You all did really great. Thank you. Okay, so moving on, we have we'll be looking at annual drug arrests. So total annual drug arrests saw an increase in 2018, but had the lowest number of annual drug arrests in 2019 since 2015. With the general pattern of the highest rates occurring in the panhandle of the state, and declining as you move through the south, the lowest rates for drug arrest are in the southernmost part of the state, served by Broward Behavioral Health Coalition and Southeast Florida Behavioral Health Network. Um, Citations for driving under the influence of alcohol have steadily declined more than 25% in Florida as a whole over the period of observation. The same pattern of geographic variability observed for drug arrests is not observed for DUI citation, however, where it's more dispersed throughout the state for DUI citations. Most Florida regions have experienced a similar steady decline in rates of citation over the period of this time. And Broward County Health Coalition is the only exception with a marked increase in 2017. So we had, oh wait, hold on. Okay, so we'll have annual adult drug arrests that we'll go over. And this had the same trend line for as we saw for the annual drug arrests. So we see the increase in 2018 and the lowest point in 2019 with 128,000 adult drug arrests in 2018 and 106,000 drug arrests in 2019. Now we'll go over annual juvenile drug arrests. So annual juvenile drug arrests had the highest drug count in 2015 with 6,000 juvenile drug arrests. We see a steady trend from 2016 to 2018, and then a dip in drug arrest among juveniles in 2019 with just over 3,000 drug arrests. And this is a huge decrease when we compare 2015 to 2019 data. So there's a huge difference there. Okay, and then moving on to alcohol and drug-related motor vehicle crashes, injuries, and fatalities. So driving under the influence of alcohol and other substances increases the risk of motor vehicle crash. Continuing up the injury pyramid for substance use, which we just went over, fewer crashes involving substances occur than citations for driving under the influence of alcohol. But a portion of these events result directly in traumatic injury that at times is fatal. Data for motor vehicle crashes involving alcohol alone, drugs alone, and alcohol and drugs are presented here. In 2020, there were 4,429. impaired driving crashes involving alcohol alone. Of these 4,429 crashes, 297 were fatal crashes from alcohol only and resulting in 2,487 injuries from impaired driving crashes. Motor vehicle crashes involving alcohol and/or drugs have decreased from 2015 to 2017. Fatalities among all alcohol-confirmed drivers were highest for the age group of 25 to 29-year-olds. Fatal crashes among drug-confirmed drivers were also among the age group of 25 to 29-year-olds. The highest drug-confirmed crashes were found in the region served by Lutheran Florida Services. Alcohol-confirmed crashes were also the highest in this region as well. When we look at when we look at motor vehicle crashes confirmed for having both drugs and alcohol, there were 386 impaired driving crashes from alcohol and drugs, resulting in 300 fatalities and injuring 324 out of the 386 total crashes that involved both drugs and alcohol. Motor vehicle crashes confirmed to involve drugs other than alcohol are as follows. Impaired driving with drugs only resulted in 673 confirmed crashes. This resulted in 348 fatalities from impaired driving crashes with drugs only and leaving 559 injured from driving crashes from drugs. So continuing to move up on the pyramid, we have morbidity. Though the use of some substances, such as opioids and stimulants, may be used to treat conditions such as acute pain and attention deficit disorder, the use of substances is associated with an increased risk for poor health outcomes. One of these outcomes is overdose and is a result of substance use. Working up the injury pyramid, morbidity results directly from substance use and is a consequence that occurs among a proportion of people who use substances. To characterize morbidity by escalating severity of consequence, emergency department visits due to non-fatal overdose are characterized first. Hospitalizations resulting from more severe non-fatal overdoses are characterized subsequently. Following a 4-year increase in non-fatal poisonings treated in the emergency department, the rate of emergency department visits for non-fatal poisonings declined from 2017 to 2018 in both Florida and the nation as a whole. Increases over the period of observation were much slower in Florida compared to the US, resulting in a rate of ED visits for non-fatal poisonings in the nation about 3 times the rate in Florida. The majority of these poisonings are drug poisonings. However, non-fatal poisonings in Florida progressively increased throughout 2019, resulting in more non-fatal poisonings treated in the emergency department in 2019 than in 2018. So as we see here in the graph, we saw an increase in 2019. However, in 2017, we see the highest amount of emergency department visits for all drug hospitalizations with 41,000 visits in Florida. All drug non-fatal overdose emergency department visits only for the first half of 2020 is shown here. In the dotted line, you'll see 22,860 emergency department visits. So that is from January through June of 2020. So, if we doubled this first half of 2020 data for the rest of 2020, we would expect to see around 44,000 emergency department visits for drug non-fatal overdoses. This means that there could be an increase in emergency department visits for 2020. The significance of this data is that the possibility of increasing emergency department visits puts a strain on our hospital systems, especially during this time, which was the beginning of the COVID-19 outbreak. This slide shows opioid-involved non-fatal overdose emergency department visits, whereas the previous slide was all drug emergency department visits. Only the first half of 2020 data is available again. With just over 10,000 opioid non-fatal overdose ER visits, this accounts for about half of all the drug hospitalizations as we saw in the previous slide. If we double the first half of 2020 non-fatal opioid overdose emergency department visits, we could estimate to have over 20,000 hospitalizations for non-fatal opioid overdoses for 2020. This means that we can estimate to see an increase from 2019 to 2020 for opioid-involved non-fatal overdose emergency visits. So this means that we might likely see the highest amounts of emergency department visits that we've seen in the previous years shown here. Okay, and then at the top of the injury pyramid, we have mortality. Mortality are those direct consequences of substance use with the most severe health outcome, fatal drug overdose. Following a 4-year increase in the rate of drug poisoning death in Florida, the state as well as the nation saw a decline in drug poisoning mortality in 2018. However, the mortality rate for 2018 remains over 3 times the rate observed for 1999. Early in the current epidemic of fatal drug poisonings, the mortality in Florida exceeded that of the US overall. After a decline in the early 2010s, during which the mortality rate in Florida fell below that of the nation, the rate in Florida began trending up again. For the first time in nearly 2 decades, the rate of fatal drug poisonings in the nation declined. The same decline occurred in Florida. This occurred in 2018. However, provisional estimates for 2019 suggest that these deaths rose again and will continue to rise in 2020. So we're expecting to see another increase in 2019 and 2020 for fatal drug poisonings overall. When we look at this graph, we'll look at drug overdose deaths in Florida from 2015 to 2019. While fatal drug poisonings declined in 2018 for the first time since 2013 in Florida, an increase in fatal drug deaths in 2019 was observed. In addition, death due to fentanyl and fentanyl analogs increased in 2019 from the previous year. Polysubstance use also continues to be involved in an increasing number of drug poisoning deaths, particularly related to opioids and stimulants. No provisional data is available yet from Florida Health Charts for 2020, but we do have data from 2015 to 2019. The height of the drug overdose deaths in Florida occurred in 2017, but 2019 is not far behind from overall drug deaths. While the hospitalizations from previous slides show it's interesting to see if 2020 drug overdose deaths in Florida will exceed 2019 death data. Because if you notice in the previous slides, the trend line also follows the same trend line here. So we see that increase in 2017, the decrease in 2018, and an increase in 2019. So we're expecting to see another increase in 2020. And then we can look over opioid overdose deaths, specifically in Florida. So again, there's no provisional data available from Florida Health Charts for 2020, but we can look at this and see a similar trend line from the previous slides. We see the increase from 2015 to 2017 and a dip in 2018 for opioid overdose deaths. However, for 2019, we see the highest amount of opioid overdose deaths in Florida with 4,294. Again, it'll be interesting to see what 2020 provisional data will tell us. And it'll be interesting to see if we'll see another increase in opioid overdose deaths. And my guess is that we unfortunately probably will. So I think this is a great place to stop before we move on. I'll turn it over to Rebecca.
Hey everyone, we're going to go ahead and take our 5-minute break and we will see you all back here at about 11:01 or 11:02. Thank you. Hello, everyone, and welcome back to today's webinar. Mr. Hackworth, if you're ready, I will go ahead and turn the presentation back over to you.
Thank you, Rebecca. Okay, so I want to just quickly go over everything we went over before we move on. So we definitely talked about the injury pyramid of substance use and high-risk behaviors. We talked about negative consequences such as arrests, vehicle crashes, and then we also talked about emergency department visits and hospitalizations. And now we're on to mortality. So the rest of the slides will be over the medical examiner data, and that will be all over death data. So we'll be going over that right now. Okay. So if we refer back to the pyramid, the last substance abuse consequence that we cover is death caused by substance abuse. Since our last webinar on substance use patterns and trends, the Florida Medical Examiners Committee has released its interim report for the first half of 2020. This means we will be discussing drugs in deceased persons data from January through June 2020. Of the cases seen by Florida's medical examiners, toxicology results determined 7,040 cases of drugs present at the time of death. When we compare data from January through June 2019 to data from January through June 2020, we find that all drug-related deaths increased by 13%, or 829 more deaths. 3,834 opioid-related deaths were reported for January through June 2020. This is a 30.5% increase, or 897 more deaths. Of the opioid-related deaths, 3,034 were the cause of death, which is a 51% increase, or 1,029 more compared to January through June 2019. An important note before we move on is that each death is a single case, while each time a drug is detected represents an occurrence. The vast majority of the 7,040 deaths had more than one drug occurrence. This indicates polysubstance use, either intentionally or unintentional, among deceased persons in Florida. Other drug data in the interim report that should be highlighted here are as follows. Benzodiazepines, such as alprazolam or Xanax, is the most reported benzodiazepine among the deceased. Klonopin has also seen a 51% increase in occurrences from the previous reports. This is used to treat seizures, panic disorders, or anxiety, but may be an up-and-coming benzodiazepine to become abused. The occurrences of cathinones, which are a class of drugs that give off stimulant-like effects, increased by 436%. With the majority of the cathinones reported were Eudelone, which I have written a trend alert about on FATA's website. So if you all want to learn more about Eudelone, you can go on FATA's website and learn more about that. Lastly, the abuse of gabapentin and kratom are also seeing an increase in among deceased. So those are like some highlights from the 2020 interim report, and we'll go more in depth with those deaths in the upcoming slides. Okay, so prescription drugs, specifically that are those that are opiates, are shown here. Methadone is in gray, hydrocodone is in orange, and oxycodone deaths are in blue, are stacked on each other in the bar graph and separated by the managing entities. Out of the three prescription opioids, oxycodone had 575 occurrences, and this is the most deaths by prescription opioids, more than methadone and hydrocodone combined. All three prescription opiate drugs cause of death also increased for the first half of 2020. So when I mean cause of death, I mean that the medical examiner has determined that these prescription drugs have caused the death of this person versus being present at the time of death. So the cause of death of prescription drugs are increasing for the first half of 2020. When we look at prescription opioid drugs by managing entity, we can count the number of deaths and the rate per 100,000 population by region. So for Big Bend community-based care, they had 65 deaths combined and 4.2 deaths per 100,000 population. Lutheran Services Florida had 227 deaths combined and 5.8 deaths per 100,000. Central Florida Behavioral Health Network had 358 deaths combined and 5.9 deaths per 100,000. Central Florida Cares had 118 deaths combined and 4.1 deaths per 100,000. Southeast Florida Behavioral Health Network had 108 deaths from these three prescription drugs and 5 deaths per 100,000. South Florida Behavioral Health Network had 78 deaths combined and 2.7 deaths per 100,000. And Broward Behavioral Health Coalition had 49 deaths combined and 2.5 deaths per 100,000. Fentanyl is a powerful opioid that is similar to morphine, but is 50 to 100 times more potent. Although it's a Schedule II prescription drug, 2,083 of the 2,838 fentanyl occurrences were illicitly obtained. For the first time since 2013, alcohol was not the most prevalent drug reported. The most frequently occurring drug found in decedents were fentanyl, with 2,838 occurrences. There were 905, or excuse me. So when we look at the graph here, these percentages, so 93% of the deaths with fentanyl involved a combination of another drug. So polysubstance use is very highly likely with fentanyl. 92.4% of deaths with fentanyl were the cause of death. And when we look at fentanyl analogs, we have 99.8% of fentanyl analogs involved a combination of other drugs. 47% of deaths with fentanyl analogs were the cause of death. Overall, there were 905 fentanyl analog occurrences for the first half of 2020, and these analogs are designed to mimic the effects of fentanyl. For age breakdown, the interim report separates age by 5 categories: those under the age of 18, 18 to 25, 26 to 34, those 35 to 50, and people older than 50. And so for these fentanyl and fentanyl analogs, the highest amount of deaths were seen in both people 35 to 50. with 1,096 deaths for fentanyl and 336 deaths for fentanyl analogs. Here we have fentanyl and fentanyl analog related deaths in Florida from 2007 to 2020. Since we only have the first half of 2020 data, that's why the line is dotted at the top, but I'll explain more. So again, we know that there were 2,838 fentanyl related deaths and 905 fentanyl analog related deaths for the first half of 2020. Meaning if we double this for the second half of 2020, in total, we would estimate to have 5,676 fentanyl deaths and 1,810 fentanyl analog related deaths. Meaning overall, we would have 7,486 fentanyl and fentanyl analog related deaths for 2020. So this is what you see in the dotted line for a 2020 estimate. So the state of Florida is likely to see about a 50% increase in fentanyl and fentanyl analog related deaths from 2019 to 2020. Again, this is just an estimate, but we're most likely going to see an increase in fentanyl and fentanyl analog deaths for 2020. Okay, this slide is the fentanyl and fentanyl analog related deaths by managing entity. They're shown in the bar graphs. Big Bend community-based care had the lowest number of deaths, but this region is also the smallest by population. So therefore, we're going to be going calculating rate per 100,000. So Big Bend community-based care had 8 deaths per 100,000 for fentanyl and fentanyl analogs. Lutheran Services Florida had 18.6 deaths per 100,000. Central Florida Behavioral Health Network had 16.1 deaths per 100,000. Central Florida Cares Health System had 18.6 deaths per 100,000. Southeast Florida Behavioral Health Network had 29.6 deaths per 100,000. South Florida Behavioral Health Network had 8.9 deaths per 100,000, and Broward Behavioral Health Coalition had 24.9 deaths per 100,000. So by population and by this rate, we see that Southeast Florida Behavioral Health Network had the highest rate for fentanyl and fentanyl analog related deaths in Florida. When we look at heroin related deaths in Florida, the occurrences of heroin decreased 1% from the first half of 2019 compared to the first half of 2020. There were 479 heroin-related deaths from January through June 2020. 84.1% of these deaths involved another drug, so polysubstance use, and 84.1% of deaths with heroin were the cause of death. The age of the decedent, again, was highest around the age 35 to 50. Heroin-related deaths in Florida is shown here from 2001 to 2020. The peak of heroin deaths is observed in 2017 with 1,057 heroin-related deaths, but has since decreased starting in 2018. 479 heroin-related deaths were reported for the first half of 2020. And so if we double this for the second half of 2020, in total, we would estimate to have around 958 heroin-related deaths for 2020, keeping a stable trend since 2018. Heroin-related deaths look quite different across the regions, looking at pure numbers, as you can see here. However, we'll look at the population or the rate per population by the following as well. Big Bend Community-Based Care had 2.5 deaths per 100,000. Lutheran Services Florida had 2.1 deaths per 100,000. Central Florida Behavioral Health Network had 2.3 deaths per 100,000. Central Florida Cares Health System had 1.1 death. Southeast Florida Behavioral Health Network had 4.1 deaths per 100,000. South Florida Behavioral Health Network had 1 death per 100,000, and Broward Behavioral Health Network had 3.8 deaths per 100,000. So these numbers may seem pretty low, but we're only looking at the first half of 2020. And since heroin is rapidly metabolized to morphine, this may lead to substantial overreporting of morphine-related deaths and underreporting of heroin-related deaths. So I just want to keep that in mind as well. Moving on to stimulants. Like opioids, stimulants are medications available by prescription for treatment of certain conditions. In spite of their medicinal use, however, stimulants can also be misused. In addition to prescription stimulants, several illicit stimulants are also drugs of abuse. Cocaine is highly addictive and is associated with adverse health effects such as overdose and death. Fatal drug poisonings due to stimulants have been increasing recently across the nation as well. Florida has experienced a nearly parallel rise with the US. Cocaine-caused deaths rose for much of the first decade of the 21st century, ending the decade with a return to lower rates for a few years. However, rates began to rise again beginning in 2013. Rates of cocaine-caused death in Florida has been consistently higher than the US. Although Florida did see a decline in deaths from cocaine from 2017 to 2018, that did not occur nationally. The rate of cocaine-caused death in Florida was 6 per 100,000 population in 2018 compared to only 4.5 deaths per 100,000 nationwide. Traditionally, there's been higher rates in the southern regions of Florida. However, an abundance of cocaine is being produced and distributed across the nation, as well as Florida. Cocaine-related deaths in Florida for the first half of 2020 resulted in 404 more deaths, or a 28% increase in cocaine-related deaths compared to 2019. 90.5% of deaths with cocaine involved a combination with other drugs, meaning that polysubstance use is very likely with cocaine. And also 66.4% of deaths with cocaine were the cause of death. The highest age range was, again, 35 to 50-year-olds with 700 deaths. Here we have cocaine-related deaths in Florida from 2001 to 2020. Cocaine-related deaths in Florida has seen peaks and valleys. However, 1,851 cocaine-related deaths were reported for the first half of 2020. Meaning, again, if we double this for the second half of 2020, in total, we could estimate to have 3,702 cocaine-related deaths for 2020. An estimated 25% increase for 2020 may occur from the previous year in 2019. So unfortunately, we might see another increase in cocaine-related deaths for 2020. Cocaine-related deaths are shown here by managing entity. Big Bend community-based care had the lowest rate with 4.5 deaths per 100,000. Lutheran Services Florida had 8.6 deaths per 100,000. Central Florida Behavioral Health Network had 7.8 deaths per 100,000. Southeast Florida Behavioral Health Network had 9 deaths per 100,000. South Florida Behavioral Health Network had 8.2 deaths per 100,000. And the most cocaine-related deaths were seen in Broward Behavioral Health Coalition with 11 deaths per 100,000. Methamphetamine is another stimulant, which is chemically similar to amphetamines. An overdose of methamphetamine can result in stroke, heart attack, organ problems such as kidney failure, and death. However, there has been no leveling off as we have seen in other substances thus far. We're seeing a huge increase in methamphetamine. Methamphetamine occurrences increased by 44% compared to the first half of 2019. There was just shy of 1,000 methamphetamine-related deaths in Florida for the first 6 months of 2020, with a 98% of deaths with methamphetamine involving another drug. So polysubstance use is highly likely with methamphetamine. 46% of these deaths with methamphetamine were the cause of death. And again, we see that same age range of 35 to 50 as having the highest death rates. Here we have methamphetamine-related deaths in Florida from 2004, not 2014, sorry. 2004 to 2020, methamphetamine-related deaths have continued to increase in Florida since 2015. 962 methamphetamine-related deaths were reported for the first half of 2020. Meaning if we double this for the second half of 2020, in total we would estimate 1,924 methamphetamine-related deaths for 2020. The estimated 35% increase in number of deaths for methamphetamine for 2020 is estimated to occur. So again, we're still climbing the methamphetamine-related deaths for Florida, unfortunately. Oops. So methamphetamine-related deaths across the managing entities differs by region. We have a higher number of occurrences seen in the Big Bend, Lutheran Services, and Central Florida Behavioral Health Networks, which are all regions in the northern part of the state, whereas lower number of methamphetamine-related deaths occurrences can be observed in the southern regions of Florida. By population, Big Bend community-based care had 8.9 deaths per 100,000. Lutheran Services Florida had 7.3 deaths per 100,000. Central Florida Behavioral Health Network had 5.7 deaths per 100,000. Central Florida Cares had 3.6 deaths per 100,000. Southeast Florida Behavioral Health Network had 1.3 deaths per 100,000. South Florida Behavioral Health Network had 0.8 deaths per 100,000. and Broward Behavioral Health Coalition had 1.5 deaths per 100,000. So again, the southern regions of the state are seeing very low rates of methamphetamine-related deaths versus the northern part of the state is seeing the higher rates of methamphetamine. So to recap everything we've talked about, youth substance use, um, we talked about binge drinking, alcohol, and marijuana rates, as well as prescription drugs. We're seeing a decline in alcohol use and binge drinking among youth. And marijuana rates continue to stay pretty stable with um, not much variability with increasing or decreasing in the past few years. Substance use consequences. So we talked about annual drug arrests that have decreased in 2019 for adults and youth. Morbidity and mortality. We discussed this with the emergency department visits, and they're expected to increase for 2020 for all drug and also for opioid involved non-fatal overdoses. For opioids, deaths from illegal fentanyl and its analogs will continue to rise in Florida for 2020. The fact that fentanyl has surpassed alcohol deaths is monumental. This data highlights the need to increase prevention by expanding awareness, harm reduction, and access and availability to treatment across the state. What many drug experts are attributing to the fourth wave of the opioid epidemic are stimulants, such as methamphetamine and cocaine. For Florida, we will see an increase in stimulant deaths for 2020. Cocaine deaths are the most are for the most part evenly distributed throughout the state, whereas methamphetamine deaths are highly concentrated in the northern Florida and some parts of central Florida area. Again, I want to thank you all for listening to me spew out all this data. I really appreciate it. It is helpful information to know and bring back to your communities. So I appreciate your participation also in the chat box, and I think we'll move on to questions now.
So Ben, we have one question. Is it possible to access the raw data that was used in this report?
Yes, so specifically for the medical examiner's data, you can go on, you just Google Florida medical examiner's data, and you'll find the examiner's report raw data on there.
Thank you, Ben.
Okay, I see the chat box. I'm just gonna answer some questions. So to confirm, fentanyl has exceeded alcohol as the number one cause of substance abuse related death in Florida as of 2020. That's correct. For the first half of 2020, fentanyl has exceeded alcohol for substance related deaths. So, okay, so I have a question about the managing entities. Okay. So the question about the managing entities, I hope this clears it up more. So I think they had a question about South Florida Behavioral Health Network. That is the most southern part in the light pink, I guess you could say. And then the Southeast Florida Behavioral Health Network is in that like coral. That would be like West Palm and those counties. Okay. Sources of Strength Suicide Prevention Program is yes, I actually I've heard of it. I know in Kentucky they're working a lot with Sources of Strength um, suicide prevention program. It's supposed to be a really good program and highly evidence-based. Um, do you have a top-rated or suggested prevention program for adolescents? Um, I think that depends on the substance. There's there's different programs, prevention programs for certain substances that specifically target those, but I can't give like one general one. I don't think off the top of my head. Okay, there's a lot of questions.
Ben, would you like
Yeah,
me
go
to
ahead.
kind of try and help you work through these?
I'm just reading through them, sorry.
No, that's fine. I just want to make sure.
Okay, so yeah, sorry. Okay, there's one that says any theories on the increased use of methamphetamines in the north versus the rest of the state? Okay, so there has been theories that so the methamphetamine and heroin has been produced in Mexico. And there's a theory that the pipeline for methamphetamine travels along Interstate 10. And where does Interstate 10 go? It goes right across the Panhandle all the way to Jacksonville. So there's a theory that it's basically transportation, ease of access that has been sort of one reason why there might be an increase in methamphetamine use and related deaths in the North versus the South. Also, there's a long history in the very South, like Miami Vice era, with cocaine. So there might be some drug wars as well. That's also been talked about, where cocaine is more prevalent in the South and vice versa. But obviously, with what we just saw with cocaine-related deaths, that's being more distributed evenly throughout the state, whereas methamphetamine is more, concentrated in the northern part. Um, we're looking at a program that targets marijuana vaping. Um, so I would say, and any idea of any EBPs? I know, oh my gosh. There's one out of, honestly, I would just look up anything from CDC. Um, I know Broward County, where I used to work at, um, had a vaping prevention program that they would teach to the schools. You could also reach out to um, United Way in Broward County. Um, but they target vaping prevention in general because um, you know whether it's marijuana or tobacco, youth shouldn't be smoking or using vaping in general, right? So I know they have a really great um, program that they use. I can't think of any national ones off the top of my head. I think there's one called Catch My Breath, actually. I think is the national one. I hope that answers your question, sorry. Let's see what else. I think that's all the questions. I think I answered. Any other questions? Okay, I think that's it. Thank you all so much for staying on and listening to my presentation.
Well, thank you so much, Ben. I'm going to take back over and get our conclusion slides going. And thank you, Mr. Hackworth. We've included Mr. Hackworth's contact information so that you may contact him with any future questions. Ben, we really thank you for all of your work you put into this webinar and all the valuable information you shared with us today. We are sure this training will help practitioners better serve those struggling with the disease of addiction. Please note a couple of items of business before we conclude. When I conclude today's webinar, your browser will take you to an evaluation on FADA's website. If you want to receive CE credits or statement of credit for this event, please complete the evaluation. You will be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CEs to be reported to CE Broker for Florida licensed healthcare practitioners, you must provide an accurate Florida Department of Health license prefix and number for the first time you register. After you register or sign in, you will be directed onward to the evaluation. You may consider using the same email address when you registered for the webinars through our WebEx link and when you set up your profile in FADA system. This helps connect your attendance to your profile. You will get a second opportunity to complete the evaluation through a follow-up email later today. The sender will be messenger@webex. The evaluation will close on midnight at Tuesday, July 5th, 2021. We do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile. Thank you for participating in today's webinar. We'd like to recognize and thank especially the Florida Department of Children and Families Office of Substance Abuse and Mental Health for funding today's education. Have a great rest of your day and please hold for the evaluation.